and then we will discuss about these two options. When or which one will you prefer, and what are the contraindications or side effect of these medications. We'll go in depth into this particular two medications. Right?
And Dr. Ryu from Korea University. I will talk about antibiotics in acne patients. I personally think that isotretinoin works better for acne than antibiotic. But when you consider side effects of isotretinoin, your first choice will be antibiotic. 3 to 4 months are recommended to reduce the resistance, but in clinical practice, antibiotics are used for longer duration than recommended in guidelines.
It is very interesting to know that in Korea, you use quite a lot of minocycline. Because in Malaysia, we hardly use minocycline because of the risk of the hyperpigmentation. What are the risks of the gray pigmentations that have you come across any in terms of the patients that you've started on minocycline?
I sometimes experience hyperpigmentation while using minocycline, but it is not severe. And if I stop it right away, it goes away. So I didn't experience any serious events, hyperpigmentation.
I see. What about Joyce? Do you use it in Singapore, minocycline?
Yes, I do. But my first choice will be doxycycline because I find that photosensitivity is not common. So the next question is that, is low-dose isotretinoin as effective and tolerable as conventional doses? So let's look at some RCT. The first one I'm going to talk about will be on moderate acne, and this is a paper where they treat 60 patients for 24 weeks. So the low dose was 0.25 to 0.4 milligram per kg, and the conventional dose is 0.5 to 0.75 milligram. They find that whether it's low dose or conventional dose, the efficacy is the same in terms of acne grading and lesion counts. However, with low dose, you get less side effects, and patients are more satisfied with the low dose. What about the relapse rate? So they followed the patient up 1 year after the treatment, and they found that the relapse rate was slightly more in low dose, but it's not statistically significant. So let's look at another study where they use low dose versus conventional dose in nodular cystic acne. So the dose that they used was 0.1, and then there's another group that's 0.5 and 1 milligram. So I guess 0.5, 1 milligram would be considered as conventional dose. And they treat them for 20 weeks. Again, improvement is the same, whether it's low dose or not. And again, side effects are less with low dose, which is expected.
I know the only thing I need to change my practice is because of the patient experience depression. I experienced less than 5 patients experience depression, and they told me when I up dosing, they feel more depressed. When I lower the dosing down to 20 milligram per day or even lower, about 10 milligram per day, they feel not depressed at all. So I think it is really dose dependent. So that's the only thing that I need to adjust the dosing. But
so we have one question from the audience as well. For pregnant women with acne, what topical agents or antibiotics can be used? What oral antibiotics can be used? I think just now we discussed on the planning for pregnancy already, right? But for pregnant women, we also discussed a bit, right? During the first trimester, you can still take tetracycline and erythromycin. It's just that second trimester onwards we can't. But topical agents, we have another question here. How to treat acne breakout during oral isotretinoin? Okay. So acne breakout, I think what this participants is asking, very severe nodular cystic acne that you encounter.